All right, this is our pathways. This is a practice patient. It's not a real patient, so there's no HIPAA stuff. So pathways, we're gonna start. We need additional visits to be performed. And then this pops up. It says comorbid conditions. That's where you put like whatever they have, like diabetes or hypertension or whatever. And then ask for zone tools. You could pick a specific zone tool or just delete it. So it's just easier doing that. And then we press save. And then we move on to MedSurg. Click on MedSurg. And then pretty much skip that first one. Then we go to best practices. Usually it'll be highlighted and it'll tell you things that you have to select. Just know on best practices, if they're if they're diabetic, always select diabetic best practices, and then then fill in the blanks. And then if they have heart failure, always select heart failure. That's a must do's for standard practice. So just know that. If they have nutrition issues, nutrition. If they have any form of pain, select pain. But 100% diabetic, always select diabetic best practice. And heart failure, if they have it, 100% all the time. And if heart failure is a primary diagnosis, you would select that. So the main interventions that, whatever applies, the main reason we're seeing them, you select it. Don't select everything, because then we'll have too many interventions pile up on us. So I'm going to run down the main ones that we see often. So if they have a Foley, we need to do Foley care. Altered urinary system, select that. Skilled procedure related to urinary system. Insertion management of indwelling catheter. And then we'll fill in the blanks. Insertion of 16 French, blah, blah, blah. Monthly, blah, blah. So that's where we do the Foley interventions. So if they need a Foley, that's where you got to put that. So that's the one that we use often. And then also next one is the wound care. So it'd be under integumentary, altered skin integrity. Select that. So if they need wound care, we would select wound care. And just know, if there's any form of pressure ulcer, stasis ulcer, select the first one, need for wound care. And then you fill in the blanks for whatever wound care you're doing. The second one is for incisions. So if it's a surgical wound that we're just doing something real simple, then we'll select that one. Same deal, fill in the blanks. And then the third one should be for wound vacs. So first one, pressure sores, then surgical incisions. Third one for wound vacs. Negative pressure, fill in the blanks, whatever is ordered. And then if it's not any of those, like a skin tear or a trauma wound, need for wound care not otherwise specified. So just know, it's always the same. For skin, you go there. The next one is IV antibiotics. So we get IV antibiotic patient that we need to administer, not administer, but to teach and do weekly labs and pig dressings. We select medication management. Then we need for infusion. And the ones we always need to select is IV administration of central line device. Even though we're not administering the medicine, we still have to put it like we are going to administer it just in case. So fill in the blanks, what antibiotic or whatever, for how often, TPN or whatever the heck it is. Just know that we do have to select need for administration via central vascular device, need for central vascular device dressing site care for our weekly dressing changes for the PICC line or whatever line it is. And then blood specimen collection via central vascular device. Then we select, so those are the three. And then you put in whatever labs are needed. And in the labs, I also like to put in which doctor's MPI, the fax number, even diagnostic codes for the labs. So you have it all in one order so you don't have to be jumping around everywhere. So I like to put everything in here. So if it's not in fill in the blanks, I'll just type it in on the bottom. So that's for IV infusions. So that's always the same. And just know, if the patient has multiple doctors, or we need to add therapy or add of any kind of therapy, go to need for other disciplines. And And this is where we click in PT, OT, SD, or whatever is needed. But before you select it in your starter care, go to medical records and go to your calendar to make sure therapy is not already plotted, because sometimes they'll pre-plot their physical therapy, and if you see like PT's schedule for the next day, then we don't need to add physical therapy. But if it's not on the calendar, then we need to give the patient what they need. This is our to-do list. Whatever the patient needs that we need to help on needs to be in here. So we give them what they need. So we just say PT, OT, or whatever. And then if they have multiple doctors, which pretty much all of our patients do, add it here. Need for additional physicians. And this is where we put every doctor they have in case we need to get an order from one of these doctors. It says may accept orders from these doctors. Otherwise, it'll slow us down. So put in a doctor. I'm going to put the pharmacy number or DME companies. I'll put in all the numbers here, so I just have it all set together like a grocery list. So other than that, there's other like cardiovascular, GI. If there's ostomy care, altered gastrointestinal, need for procedure, and that's to be coloscopy, teaching, and all that. Other than that, INRs. So we have to do INR checks. So we would go to lab. Let me see here. Need for diagnostic testing. Need for blood draw. Nope, not that one. That's for normal labs. But for INR testing, I believe it's here. It's been a while. Yeah, for under medication management, need for anticoagulation monitoring. So it should be under diagnostic tests, but for INR tests, it would be go to medication management, need for anticoagulant monitoring, and then you add the need for PT-INR, need for anticoagulant management, choose one for PT-INR monitoring. And then it'll be for the ranges. Usually it's need for INRs without specific target range. And then need to perform PT-INR weekly. Call this doctor for results. Whatever Coumadin clinic. So just know for INR checks, it's going to be under med management, anticoagulant monitoring, and just work your way down to get to INR monitoring without specific range. Otherwise, so it's like respiratory, go for trach management, because like respiratory, and just work your way down to get to that point. But those are the main ones that we use often. And other than that, I think we're good. And also diabetics, say if we're going to do insulin for the patient, like we have to do insulin, we've been pre-approved. Need for intervention for diabetes. And it would be need for diabetic care, insulin administered by agency. And select that one and then edit. Basically here I just delete weekly for 8 weeks. You have to select this one so you get the right interventions pop up. Because if you put for like diabetic insulin teaching, that's not the one we need if we are the ones giving it. So just know, for diabetes, if we do insulin, we need to select that. If we're just teaching, then we select observation and assessment. Let me see what else. But those are the main things to know. Main things that we pretty much are the main to-go interventions for us. But just know heart failure, always select that. We always need some intervention for heart failure.